Hello, uh, I'm Dr. Pinotti from São Paulo, Brazil. I'm sorry I couldn't be personally in the meeting with you, but I'm sending this video to tell you about our experience with the dynamic angiothermography in Brazil, in our studio, in our clinic, with Brazilian women. We have using the device for the last 3 years. We have about 300 cases done, 12 diagnosed cancers, and 8 cases that we consider false positive, but we are following every 3 months, hoping if we find something, we'll find very initial and to see those patients. We have no false negative, which is very good. All the cancers that we'll find in mammography, in echography, and in magnetic resonance, we saw in the Datg. So we consider it a very good method for diagnosing breast cancer, first of all, and for screening. That is our best aim with the device today in our clinic, in our service. Patients like it very much because it's painless and it's no radioactivity, and it can be performed every time they come to the office. When we do clinical examination, we do together with the Datg, which helps us a lot to give security to our patients. So we've been using it to diagnose breast cancer and to do screening. As you know, the flow of every woman is like a fingerprint. So if we have the photographs of this woman in her uterus, we can follow her for 30, 40 years, that they will have the same image, like a fingerprint will maintain in their breasts. The learning part of our experience was very interesting. It's not very it's quickly to learn if you have a lot of cancers to see, because in my experience was very important to see how cancer looks like. For then we can pass through the screening part of it and see normal breasts. So we have to find the deviations of the vases. We have to find the vases that doesn't end in non-pointed terminations. We have to find vases that go to other territories that are not their territory. We have to learn how to find the malignant star. So when you find these abnormal compartments of the vases, you can be secure to do screening. So in my opinion, you have to have good teachers. The method is there, and how to teach, it's not a very difficult thing, and you have to see a lot of cases of cancer. So see by yourself, or see in the atlas, or see in the images that we have in our computer. So if you train a lot your eyes to know how to see cancer, then you are ready to see to do screening with the Datg. Important to say, and I will say it again, that is a method that you can use in children, in men, in pregnant women, in women that are doing chemotherapy for breast cancer, in women that are doing hormone therapy for breast cancer, in women with genetic alterations, BRCA1 and BRCA2 positive, in young women with dense breasts, doesn't matter. The flow, the vases will be the same in those women, the follow-up will be the same, and it helps us a lot. That is a method that can be used in everyone. So that's a very important advantage. The second one, in my opinion, is a very the characteristic that seeing a big cancer and seeing a pre-cancer lesion, a small lesion, we'll see the same alteration in the vases. And that's amazing and that's beautiful, because sometimes a very tiny lesion and a very tiny cancer or a pre-cancer lesion will give us the same image as a big cancer. So we can see the alterations in these two pathological changes. The alteration will be the same, and that helps us a lot to find very tiny lesions. That is our objective in screening breast cancer. Some very good studies have been done in the pathological pieces of the biopsies of the Montricoli series, and the one that I like the most is one published by Fernando Smith, that is a pathologist that used to work in the IPATIMUP, a very important center of biological molecular studies in Portugal, that studied the presence of VEGF, that is a neoangiogenic marker for breast cancer, and he found in the breast cancers the VEGF positive, and he found in the pre-cancer lesions the same VEGF, telling us that probably those tiny lesions founded by the Datg were lesions that will develop in the way of cancer, and those lesions had to be taken off, and it's important advance, because it's something that we, with the mammography and the echography, can tell in a lot of cases. For example, very suspicious microcalcification that we take off can be liponecrosis, can be adenosis, can be a lot of benign things that won't lead to cancer. But when you find wrong vases by the Datg, most of part of them have this VEGF alteration that will lead to cancer. So it's a very precise device when you know how to use it well. Just to finish my talking, I would like to point the advantages that we find the most important one. So the first of all is detection of breast cancer. The second advantage that I found very, very important is that we can use in all patients anytime we want, and it won't give radiation and it won't give pain, and it's comfortable, and we can use in the office. With every time you do breast examination, you just complete it with the Datg. We can use for screening. We have this fingerprint when the woman is young, that you can follow her every 6 months, every year, and you have the same image till something change, and it's a very important advice for you to do something, to go after this lesion and take it off. It's a very good exam to find precancerous lesions, pre-malignant and DCIS, and it's very important for us today find the tiny lesions. It's a very good way of monitoring the neoadjuvant therapy for breast cancer. The big tumors that we want to make it smaller before the surgery, we can follow with the Datg the good action of the drug. So if you have changing the pattern of the flow, you can see that it's going down and down and down. It's working, and it's very good to monitoring. And it's a very easy learning and easy doing exam. So I think it's something that will be a very good thing for the women in the world, and mostly in the development countries where we don't have the access of everybody to every kind of exam, of breast exam. I hope I could show you our experience. I'm completely open for questions and for answering everything that you want to ask me. Mario Bonera has my email, and we can keep in touch to talk about the Datg device whenever you want. I wish you all a very good meeting. Thank you very much.